Back here in the zone, and we're talking about a story that goes far beyond the DMV. The Biden administration seeking to lower Medicare prices for 10 prescription drugs as all part of a new program to help America's seniors. Maya Goldman with Axios is live with us now to break it all down. And Maya, this is admirable. A lot of seniors needing this help. I'm curious, how did they decide what drugs to lower the prices of?
Yeah, thank you so much for having me. So this was a huge process for the Biden administration. It's part of the Inflation Reduction Act, which passed last year, major economic legislation. You might have heard about it, but there's a whole process for choosing which drugs to negotiate prices on laid out in that. And basically it involves calculating the top 50 drugs, the drugs that come up with the top 50 spend in Medicare dollars, and then there are some exclusions. So if you haven't been on the market for 7 years yet, and if you're only approved to treat one kind of drug, then those drugs are excluded, but they're generally the most expensive and highest used drugs in the Medicare program.
Do seniors have to do anything special to get this discount? Is it just automatic? Does the price of this medication just automatically drop for everyone?
Yeah, so that's a really important caveat. Seniors will not feel the effects of this until 2026 at the earliest. So this is a big announcement in that it's starting the process of negotiating lower drug prices, but seniors will not feel them yet. What you might feel is the $35 cap for insulin, $35 monthly cap for insulin. That's already in effect. So if you are on Medicare, you shouldn't be paying more than $35 a month for insulin. But for lower prices on these other drugs, you're going to have to wait a little bit longer.
You mentioned negotiations. That brings me to this question. Obviously, drug companies are in the business of making money. I know it's supposed to be healthcare, but money is the major motivator here. I'm sure they're pushing back. How much so, and how might this affect the conversation?
Yeah, drug companies are not happy. At least 8 lawsuits have already been filed against this by drug companies, and they're moving through the courts. So we'll see. There haven't been any decisions yet, but a lot of experts expect that this is something that could go to the Supreme Court. Drug companies are saying that the process that Medicare officials have laid out for how to negotiate the prices goes against the Constitution. Of course, the Biden administration fiercely denies that, but this is probably something that's going to play out in the courts.
That's unfortunate to see that lawsuits, up to 8 of them because of this. And so again, seniors will not see anything until 2026. Right now, negotiations continue. Is it in the hands of Congress, or who is it in the hands of right now?
Yeah, so it's basically all in the hands of Medicare officials through HHS, and then also they're negotiating with the drug companies. So there's this year-long process that kicks off next month, where the Biden administration and the drug companies go back and forth on what a fair price for these drugs would be, and that's a whole process.
Okay.
Real quickly, is there anything that people who will benefit from this can do right now to help push this through?
Yes, so there are going to be listening sessions for each of the 10 drugs, patient-focused listening sessions where patients can give their input on how much drugs should cost and how the negotiation process should play out. If you go to cms.gov, I think that the dates are listed out there, and so that's one way to get your information in.
All right.
CMS.gov it is. Thank
Maya
you.
Goldman, thank you for that information. I'm sure a lot of people will be waiting for this to finally go through. It's a good thing. I think seniors need all the help they can get, especially those on fixed incomes.
And these companies need to come up off of that money. Stop playing.